But there is an interaction effect, as I was mentioning to you as we got started. It's your patient's environment. Because fall prevention for everyone that we take care of does require that we manage their underlying risk factors. And we've talked about that already. But you also have to optimize that physical design environment. And that's why I move furniture. I look at everything to make sure that they're safe to be able to even use the toilet in a bathroom, or do they need to use that bedside commode? Knowing what height everything should be, maximizing everything for safe mobility, making sure residents have their shoes on, what kind of assistive devices that they need to have, using those gait belts. With your toileting program, we should all be using as best as we can a progressive toileting program where we do to have, time toileting, prompted toileting, everything you can to be able to help move them from incontinence to continence, not just putting residents on incontinent briefs when they're continent and they just need to be on a toileting program. But there's also a balance with autonomy and safety. And I appreciate this, and I know you do too, because not everybody is severely cognitively impaired. For people who are severely cognitively impaired, we want to make sure that we do everything we can to anticipate their needs, anticipate their needs. But for those people who are alert or have mild cognitive impairment, you still want to maximize choice and their opportunity to be able to be engaged in choice. So there are times when safety trumps privacy, and then there are times when privacy trumps safety. And that's a discussion that should be had by the interdisciplinary teams with every resident and their family members. And when you think about autonomy and privacy, it's as important as whether or not someone stays in a bathroom alone. For people who are cognitively alert or have mild cognitive impairment, there are some that really just want to have that privacy, and you have to have that conversation with them as, if you want to have this privacy, we just worry about your safety. Maybe you've had a fall before. We don't want you to fall again. And it's really better for us to be able to stay here with you and have them be able to, for those who can talk to you, be able to talk with you back about that and have conversations with them.